Hello, you guys, and welcome to today's call. We are dedicating the whole day today to breast health. And this morning I was doing a demo on a smoothie that contains no sugar and it's packed with nutrients that really help with estrogen dominance and really is gonna just relieve a lot of the inflammation, the stagnation in the breast. And then I was also showing how to make an oil for massaging your breast. And guess what? And this interview is we're gonna be showing you how to do your lymphatic massage on the breast with that oil that you could be making from this morning. So with me today is Gaye Walden, who is a wonderful expert when it comes to breast health. And, with my new book, and, the reason why we're doing all these interviews and calls and stuff is because my new book is now out, Overcoming Estrogen Dominance. And guess what? A lot of the breast issues that women have is because of estrogen dominance, right? And so how many of you here are experiencing that discomfort, swelling, pain in the breast? You might be feeling like you have felt the lump before. And I feel like, you have a history of breast cancer, or you're currently going through maybe some treatments. I feel like when it comes to breast health, it is just such an incredibly sensitive topic for so many women, because in some ways there's kind of shame around it, and we see it as a sort of a very sexual organ, but it really is an organ, is a part of us that is just such a big part of being really feminine and being a woman, but it's also an indication of our overall health. And I will never forget when I was in my late 20s was the first time I found a lump on my breast. And it was one of those profound moments when a lot of things were going really right in my life. And I had this wonderful boyfriend, and I just started traveling a lot for international traveling. I got promoted to a regional office. And I'll never forget how when I found that lump, and it was just like that moment of everything falling apart. And I felt like my life was gonna end, and I was sure I had breast cancer, and in all the conversations you go through. But then you find yourself with the next obstacle, and that is, how do I get it diagnosed? Do I go through a mammogram? Do I do a thermogram? There's criticisms of both. Do I do a sonogram? Right? Is that good enough? And then when you do pursue whatever route, and we're gonna talk about the different options with Gail here today. Then is the wait time, right? That is, again, so super stressful. And one of my missions in life has become that I don't ever want to find a breast lump ever again. And, if you follow me for a while, I've been talking about it for a long time. I am highly predispositioned towards estrogen dominance and estrogenic cancers. There's deaths on women from estrogenic cancers on both sides of my family. Breast, uterine, ovarian cancers. And so I really, since it's a personal mission, is to not be experiencing that. And that is the same wish that I have for you. My mission with this work is to impact 1 million women, helping them overcome estrogen dominance over the course of the next 3 years. It is through my book, interviews with experts like Gaye, doing these videos, doing all this amazing work that is coming together now, in form of recipes, supplements, and a lot more, and herbs, of course. So today we're talking about fibrocystic and lumpy breast, and we are, for those of you joining a little bit late, we're gonna be doing a couple of giveaways, and Gaye is gonna be giving away a couple of herself, and it's a roll-on, and we'll talk a little bit about that. So and an iodine-based solution for breast health as well. We're going to talk about iodine and breast too. So stay tuned for that. But the way this is going to work, you guys, the winner is not just going to be like a random person that we pick, but we're going to be quizzing you. So whatever Gaye is going to be giving us this awesome info, I'm going to pop a little quiz, a little question towards the end. And whoever is the first person to answer it right, you're going to get the 2 products, or we're going to select 2 winners, and then each person is going to get a product. Okay. Welcome, Gaye. So good to see you again.
Thank you so much, Magdalena. I enjoyed our first interview, and I've been looking forward to this one. Hello.
Yeah, our first interview was so well received. There were so many women, who were absolutely in love with you and just your warmth and personality. And I just wanted to share with everyone the way I met Gaye was actually one of the women in our community has just posted on our forum saying that, hey. Actually, the question that I posted was, what helped you with, if you had fibrocystic breast, painful breast, if you had a lump on your breast, what helped you? And so, a lot of people came on and talked about magnesium and reducing coffee and doing a lot, like incorporating maybe a bit of iodine and doing some supplements and herbs and stuff like that. And one person came on, she said, everything changed for me ever since I started working with Gaye. And I'm like, who is Gaye? And so I looked you up, and I loved your website, and I loved your personality and warmth, and I feel like we're two kindred spirits. And that's how we met several months ago, and our call was very popular. So let's dive in.
Yes.
Let's talk a little bit about, like, what do you see as being the underlying causes of women developing breast issues?
Well, obviously, hormonal imbalance, Magdalena. Your book is going to be well received. I'm sure it already has been well received by those of us. Thank you for sending it to me who've read it, because hormonal imbalance is definitely a risk factor with breast cancer. When I do a consult with women following a thermogram, it's one of the key topics I discuss with her and make sure from a lifestyle standpoint, she's doing all the things that you mentioned in your book and more to create this balance that our body needs in order for the breast tissue to be healthy, because toxins hang out in the fat cells, and we know that fat is in our breast. So we really do have to work diligently to make sure that tissue is healthy. And you're right about how breasts are viewed in our culture. They're viewed as a sexual item on a woman's body, not even belonging to her in some cases, belonging to her partner or spouse. But in reality, we were given these breasts to define us as women and also to feed our young. So we do have to make every effort, like every other part of the body, to take good care of them. And one thing that most women don't know that they need to do, you don't know what you don't know, is touching the breast, examining the breast, which is not promoted any longer we used to have a little thing in the shower. I don't know if you guys remember, that's dating me a little bit, but I used to put this little card in the shower, and it reminded me right after my cycle to do a breast exam in the shower. Well, that's no longer promoted. What's promoted is the screenings themselves as a way to prevent breast cancer. Well, in reality, the screenings that we are familiar with, which are mammogram, ultrasound, MRI, they're all looking for a structure within the breast tissue in different ways, and they're set up to diagnose and treat. So when you hear about screenings being preventive, they're really not preventive. It's going to tell you these screenings, yes or no. In many cases, it'll be a yes or no. If they do a biopsy, it cannot diagnose cancer. None of those screenings can diagnose cancer. Only a biopsy does. The thermogram, which is my area of expertise, is the only screening available to women that's going to give them a heads up, a forecast. And the best analogy is, unlike a weather forecast, if the weatherman says it's going to storm, it's going to storm. Or in your case, it's supposed to snow there today, 6 inches, I heard. You can reverse that forecast. There's no way to reverse that forecast. But a forecast with a thermogram is going to tell you, is my breast health going in the right direction? Are my breasts healthy? And if the forecast is saying, no, we've got some work to do, there's lots of inflammation, and that's what we're picking up. If it's not an infection or trauma, it's inflammation. And guess what, ladies? We can reverse inflammation. We all know that we can reverse inflammation in the body, and we can reverse it in the breast tissue as well when we know what to do. So here you get this forecast, and it's a risk assessment screening too. That is the way it should be used. And I've been trained to give an assessment in each breast based on certain criteria to assess the health of the breast. And whatever that number is, if it's going up to the 5, TH5 is the highest risk. 4 or 5. 3 is average, 1 and 2 below average, 3 average risk. Then we want to endeavor to reduce that risk. And my passion is to get the information to women to let them know what they can do. Because following a mammogram, ultrasound, or MRI, you're not given information. All you're given is what's the next step. And we know what the next steps are after these screenings. If they pick up something they want to further investigate, it's biopsy, surgery, radiation, and drugs. That's the system. So thermography should be added to the system. Unfortunately, it's not. And it would tell a radiologist many things that the other screenings do not tell him or her. But a thermogram is going to allow a woman to be in charge of this, because you're.
So let's talk about this in just a second. I just want to mention, it's in today in the evening I'm going to be reading that's chapter 11 on fibrocystic and lumpy breast protocol, and so one of the things I just want to show, because I mentioned you in my book. Because that's really what I've learned from you, and it's how to do a massage. And Gaye is going to be showing us today that the one thing, and so this chapter here really is going to tell you a lot about magnesium, using castor oil on your breast, what kind of supplements, what kind of herbs have a really great affinity for the breast. But the one thing I don't cover, because it's just not my expertise area, and that's part of the reason why I want to talk to you today, is to kind of fill in the gap on what I don't cover in my book, to give people, a more complete picture, is the management of breast through a thermogram. And then I want to talk to you about mammograms as well, and digital mammograms. And so let's unpack this a little bit, because that's outside of my book. And I think it's like a real nice complementary content to my book. And before you dive in, I'm just going to say, speaking of herbs, I am drinking. I just infused this just before we started the call, and so I've infused some red clover tea, as well as red raspberry leaf tea, and both of these have a wonderful affinity towards breast tissue. They are slightly estrogenic, but they also are really helpful with bringing inflammation down in the breast and support overall breast health. So that's the tea that I'm drinking. And it's in the book as well. So we have a recipe for you guys there too on breast health tea. So Gaye, why don't we just switch gears a little bit and talk about the diagnostics, something that a lot of women always ask us about. Knowing you, that's actually, I didn't even know about that. And only from talking to you, I discovered that not all thermograms are the same. So can you unpack a little bit for us, and let's talk about what kind of thermograms are there? What do you recommend? And what can women really get from a thermogram? And then let's talk about mammograms in just a second.
Absolutely. Great question. And I get asked this question all the time, Magdalena, as you can imagine. Well, a thermogram is a forecast. And I use a very sensitive, just to get layman's terms here, I use a very sensitive thermal camera to measure heat on the surface of the breast. And if you don't have an infection or trauma, we're dealing with inflammation. And inflammation is something we can reduce. So unlike the other screenings that look for structure, we're able to map out the breast tissue according to heat patterns. And I'm going to show you before the interview is up, how else we look at the images in addition to color, because color is the way to identify these heat patterns. But we also look at the images in black and white. So I will show that later on. But how it is different, like I said, it's a forecast that alerts a woman if there's something going on in her breast tissue that she would not be aware of with the other screenings. And thermography is not regulated as an industry. No one is telling me what to do things. I was very fortunate that I had one functional doctor who's a pioneer in this, spend time with me, make me understand this, and train me in the right way. So I'm very fortunate. Not many thermographers have that kind of training. Most of the time, they're buying into a franchise system where you buy the camera, the people who interpret them, so you follow their system. So what I've been able to do as an independent thermographer is have my own systems based on the knowledge and expertise of one doctor who has been a pioneer in this for years and has actually helped set the standards for interpretation for thermograms. So what you need to look for if you're looking to have a thermogram is a center that's going to, first of all of them show the images in color, okay? That's pretty standard. Not all of them show the images in black and white. And the black and white images have a story to tell. So you want both black and white and color images. You want to select a center where you know that the background somewhat of the people who will actually be interpreting them, because I don't officially interpret, although I do most of the work after the thermal images are taken, as far as identifying heat areas and doing the preliminary work. But I have a functional doctor trained by the doctor who trained me. The person is in this area, and he looks at what I do and makes the official interpretation of the thermogram and gives the risk assessment. And if you can find a thermography center that offers a risk assessment, meaning it's a scale that's been around for a while, TH1 through 5, TH3 is average risk, 1 and 2 is below average risk, and 4 and 5 is above average risk. Not everybody does the risk assessment. A lot of times the reports that are generated by some of these thermography centers are all very hard to understand. So if you can find someone who can actually go over the report and explain to you what it means, that's always very helpful. And that is what I do as a holistic health coach. I don't just take the images. I do sit down and go over it with every woman who comes here to make sure she understands it. And if she's, I ask for the other copies of the other reports of her screenings. That's very important. I'm surprised at how many women don't have a health folder, keeping all of their records in one place, not only about breast health, but for their overall health. And I encourage that greatly, because I can use results from a mammogram or an ultrasound or MRI to actually correlate our findings in a thermogram. And that is ideally how thermography should be used in this world.
Got it. So question here for you. Does that matter what kind of camera the thermographer is using?
The camera is important, and I was telling Magdalena prior to this interview that the cameras nowadays are very sophisticated. The sensitivity of the camera is more important than the resolution. The resolution, like a real camera, needs a high resolution in order to pick up detail. Well, we don't need a high resolution camera. We need a high sensitivity camera. And most all thermal cameras, the newer models, are very sensitive.
So how do you know, let's just say, we've got, like, I'm in Boulder, right? We have people from around the country and some people internationally listening today. Not everybody can go to work with you in your state.
Right.
And so, if I was to call the local thermography center, what questions would I ask them to determine if they're a good partner for me?
Well,
and if the resolution is like you said, the sensitivity is good enough for me to even go there and potentially send it to you for interpretation. Like, how do I know how sensitive the camera is?
Right. Well, get them to tell you what the sensitivity is. And you can Google a thermal camera and it'll tell you what a good sensitivity is. Of course, I can send that to anyone if you want the exact exact sensitivity rather of my camera. But I can tell you that if you want to email me about that. But the camera is it's important. It's also important that they follow the procedures that are necessary prior to doing a thermogram. You can't walk off the street on a hot day and get a thermogram. Your body has to acclimate to a certain temperature before you arrive. And when you, during the 15 minutes prior to my taking the images, your body has to further acclimate by cooling down in a temperature-controlled room. So if they're not following those procedures, you're not getting accurate results, because all of these cameras nowadays work best when you acclimate your body temperature for a certain amount of time prior to the image taking.
Okay, so we have some really great information from you on that, and it would be really helpful if you could send me the sensitivity of your camera so that I can post that later on those videos, so folks know. And so first of all, people are asking, Melissa is asking, where's Gaye located? Can you tell us?
I'm in sunny Charlotte, North Carolina. I say that because today I was telling Magdalena we're about 75 degrees here, so spring has arrived.
Right.
So
you call it spring? 75 is spring for you?
so everyone's outdoors now on a day like today. It's a beautiful day. So I am also opening an office. I'm in Chapel Hill, North Carolina. Charlotte is in North Carolina. So I own more than one camera, and I've just purchased another camera. So I do plan.
So one of the options, I know people are going to be asking us that, so I just want to pop it out there right away. If somebody has taken imagery already, can they work with you and then use what they have, or if they are about to do it and they can go and get it done somewhere with a sensitive camera, we're gonna post about how to pick that. Can they work with you remotely?
Yes, I do remote consultations because so many thermographers don't offer a follow-up session, Magdalena. They're just given a report and very little information being explained to them when they get the report. So I can do a remote Zoom presentation, discussion with you as a follow-up, and go, even if the camera is not my camera, I can look at the images and get some information. Most of the thermographers don't do actual measurements of temperature, so my reports are very detailed, but still the imaging wherever she's had it usually helps me some in being able to assess, give her a forecast, even if they don't give her a forecast through the system that I've been trained to use for risk assessment.
We already have questions coming in saying, what is, I'm just going to pop this one out here. Monica is saying, I already have images and reports. So if somebody already does, what would you say, from 3 months ago, 6 months ago, what is the longest that you would allow to look at it?
We had one a year ago, but she's not been given any information, Magdalena. Following that thermogram, I can do that as well.
Okay.
So, as far out as a year or even 2 years. But the thing is, thermography 2 years ago is not a very current thermogram. So we don't know what has changed since then. So I would say a year. If she has done a thermogram within a year, then I would be able to give her some really good information about what to do if she hasn't been given this information.
That's awesome. Give us your URL as well, and Brittany, let's pop that out. Where do people find you? Because I know we're getting a lot of questions on
Holistic Breast Health, holisticbreasthealth.org.
.org, not .com. Holistic.
I actually have both domains.
Oh, you do? Perfect. Okay, great.
Breasthealth.com or .org. Either
okay, awesome. So this is where you guys can contact Gaye directly. Okay, switching gears. Let's talk a little bit about what can thermography tell you? What story can it tell you? What, when you talk about forecasting, or if you talk about taking current temperature of what's going on, what do we get? What information can we get from it?
Well, we're mapping your breast tissue according to heat patterns. So first of all, we're able to measure, for example, if one nipple is hotter significantly compared to the other nipple. It's all about comparisons. And we measure the major areas of the breast and see what the temperatures are, and we compare them. And if anything is over what we consider significant heat, it draws attention to that area of that breast, and it does go toward the risk assessment of that breast. And then we also spot check, Magdalena, specific areas within the breast after we do the major areas to see, is there a spot in the right breast that I don't have in the left breast? And based on the color, we can see that there's a heat difference, but not everybody measures those specific areas in very detailed to see what the temperatures are, and then compare them to each other to see, gosh, you've got a hot area in one breast that you don't have there. What's going on in that area of the breast? We can address it that detailed with the tissue. Because if we find an area like that, obviously the lymphatic massage is the very first thing I recommend that women learn how to do. That, and reduce your bra wearing, and do not wear bras with wires.
Yeah, that's a big one. Do we have a great question from Petra? She's saying, does it matter in which point of your cycle do you have a thermogram? That's a good question.
It's a great question, and I do get asked that a lot too. I can image a woman at any time of her cycle. The preferred time is day 6 through 10, but even if she has it right before her cycle, as long as she gets a subsequent thermogram during approximately the same time of her cycle, we can compare apples to apples, because what we're trying to achieve over time with thermography is a baseline, what you look like normally. Obviously, we don't want you above average risk. We want to get you to an average risk and below, and then we want to monitor it, make sure it's stable, so that every year when you do this, and that's all the woman eventually should be doing this once she's stable, we can pick up any changes, hopefully in time for action to be taken if something is different.
Laurie is asking a question that I was going to ask you, and so let's dive in. She says, I've had thermography in the past. I have strong family history of breast cancer, and I've heard cases of thermography missing things. Any input on that? I would really like to go with thermography, but need to have the best diagnostics.
Sure. First of all, it is not a diagnostic screening. It cannot diagnose. They do use the other screenings as diagnostic tools, but as I mentioned earlier in this interview, only a biopsy really confirms cancer. So when you say miss something, if you've got an area deep within the tissue, remember, this is a surface test. It doesn't go deep inside. But if you were to have something deeper inside, there's a possibility that we wouldn't see heat there. So I can see why thermography, if that's the case, might not pick up an area of concern. I hope that helps answer that question.
So does that mean that there could be something as deep as even in your breast still that doesn't get picked up?
If it's laying against the chest wall, for example, or let's say it's underneath the breast, this area underneath the breast always shows up warm, Magdalena, because the breasts are laying on the tissue. Yes. So, and it's very hard to cool a woman down so that this is not warm. So I would say that thermography's challenges are, finding an area that's always warm. How do you find a warm area in an area that's always warm? That would be something. And then deep inside, not on the surface, maybe next to the chest wall, those would be two challenges for thermography.
Kelly is asking thoughts on women with no cycle and dense breast.
Okay, thoughts on women with dense breast?
Mm-hmm.
Okay, 50% of all women have this density. And I know that most women know that when they go to get a mammogram or an ultrasound, that particularly a mammogram is where dense breasts are an issue. And I think they're told, a lot of women are told that it's a risk factor for breast cancer. Dense breast has to do that you have more fibrous glandular tissue, making it difficult for the radiologist to see what he or she's looking for in a mammogram. That's why this 3D mammography tomosynthesis was approved in 2011. And it's for women with dense breast tissue. They take more images, and that's how they slice through the tissue to see what they're trying to find, which they can't see in dense tissue, because what they're looking for are little specks of calcium called calcifications, or a centimeter-sized lump, which they can pick up in a fatty breast, and they can't see that in dense tissue. So they have to take more images in order to see that, and then even then they can't. It's related to age. The younger a woman is, the greater her chances of having dense tissue, although a woman can throughout her life have dense breast tissue. And what was the answer to that question?
With no cycle, but I guess that doesn't matter, right? You can, yeah. We've got Amanda here, who's a good friend of mine, asking, what if there is a persistent cyst that grows and shrinks throughout my cycle? Is it ideal to have the thermogram at a certain point in my cycle?
Again, if you can have it done day 6 through 10, that's ideal. The closer a woman gets to her cycle, this, Magdalena, that, you feel more cyst. There is more cystic activity. There is more pain. There is more soreness. I've imaged many women prior to their cycle like this. But and again, going forward, I can image her at the same time of the cycle, and we can still compare apples to apples. But when a cyst is sore like that, it is estrogenic activity creating this fibrocystic condition, and the soreness right before the cycle.
Amanda, get on the protocol. We've got another good one here. Actually, let me just go into, okay, well, this is a good one. Rock is saying, I take bioidentical testosterone, I have breast pain. Is this normal? No, it's not. So one of the things that happens with testosterone, it gets converted to estrogen, right? And so this is where, you can prevent the conversion from testosterone to estrogen by taking aromatase inhibitors, which is in the form of chrysin. And so chrysin is a supplement, but I would be really careful. Like, why are you taking testosterone in the first place? That's, I guess, my biggest question. And just to be really careful with that. One of the things, especially with testosterone, we don't really control how much of that it gets converted. And the first hormone, the first estrogen it gets converted into is estradiol, which is the aggressive form of estrogen. And that's the estrogen you really want to look out for. So if you're on testosterone for whatever reason, if you really must, then is really, please do your Dutch testing, DUTCH, on a regular basis, and see how many estrogen metabolites do you have. How do you break down that the testosterone into estrogens, and what kind of metabolites do you have? Let's take a look at, so this is the other one that I wanted to ask you. Yeah, mammograms. There we go. Tracy is saying, are mammograms better than thermography or vice versa? I'm scared to get a mammogram.
Okay, that's a very good question. Mammograms are so totally different, and a lot of women don't want to have them because of the radiation. This is what I'll say about that. It's not one mammogram that's going to hurt anyone. It's numerous mammograms over her lifetime, because it's cumulative in the body tissue, the radiation. And the more mammograms you have over your lifetime, I think it increases your risk for the very disease it's trying to detect. So I do not promote thermography to replace a mammogram, an ultrasound, or an MRI. In an ideal world, they would all be used to give a healthcare provider a true picture of what's going on. Obviously, thermography may prevent you from getting a mammogram if everything looks good. See, if you had that information, it would help you decide, do I want another screening or not? Many women who come to me and they're high risk, they're concerned. They feel something in the breast, it's showing heat. Obviously, for peace of mind too, you may want to correlate it with one of these screenings that's going to give you that peace of mind that it's not something that you need further investigation. It's indeed a cyst, and I'll do as Gaye recommends and do the lymphatic work and get my hormones balanced, and hopefully those cysts will be resolved. But many women leave doing a thermogram and go get a mammogram or an ultrasound. And of course, in this country, you cannot get a mammogram without an ultrasound without having a mammogram. That is pretty much the system. There are some companies cropping up that will with appointment only, you can have a breast ultrasound without getting a mammogram. But in a traditional radiologist's office, you have to have the mammogram before the ultrasound. And again, ideally, all of these screenings would be used to give a practitioner a really good idea of what's going on in your breast tissue.
Sue is asking, I am being sent for an MRI because my mammograms continue to show density. Will it help?
According to what I've heard from the radiologists that I know, and I'm not in the conventional radiology field, is that it is the most sensitive at picking up structure. Yes, yeah. MRI. And they have abbreviated MRIs out there, I understand. I know we have at least one location that offers that here in Charlotte. You may want to check on that. That may be a less expensive option. I don't hear many people getting MRIs, but certainly they say it is the most effective means of picking up structure in the breast tissue.
Thank you. Let's take a look at Jill Burnett is asking, what are the most companies that provide ultrasound other than Her Scan?
Her Scan right now is the only one I'm familiar with, unless you can come up, if you can find an independent imaging center. And sometimes you'll find them, but that's a tricky road. I had one 2.5 hours away from me in Asheville, North Carolina, and they stopped doing ultrasounds of the breast. So it's very challenging to find that. HerScan is the only company right now I'm familiar with.
I have had done an ultrasound many years ago in California, and that was done through a private provider. So it sometimes is also a matter of just calling around and finding out if they have an ultrasound and they are trained on it.
Exactly.
This is, I will take this one. It's from Kristen. I have a period every 15 days. Last month I had 3 periods. I'm taking estradiol and progesterone cream. I also have a history of PCOS. How do I go about only getting 1 period a month? So Kristen, in my book, Overcoming Estrogen Dominance, there is specifically a chapter that's called chapter 14, and that starts on page 192 that talks about irregular period. And there's a full protocol on how to regulate your period. However, you don't really start off with this chapter. You start off with the foundation. So changing your diet, regulating your blood sugar level, especially if you have a history of PCOS, blood sugar balance, and the metabolic response, as well as inflammation, are the 2 first things that you really want to get under control. And then you proceed on to the add-on protocol in chapter 14 on the irregular periods, and adding some nice herbs in there can really help tremendously. So let's take a look. There's another one. Let's do like 1 or 2 more questions on thermography, and then I want to move on to what we promised you guys in showing you breast massage and how to move the lymphatic system in the breast. So Mary's asking, are larger breasts harder to read with thermography?
No, it's a surface test, so we can read any size breast with thermography. I will comment on the larger breasts. There's more fat, obviously. It's very difficult sometimes with women who are larger breasted to really get a feel for what's in their breast tissue, because there's more to cover, so to speak. And of course, we know that overall fat in the body actually, and particularly in the breast, can give you an increased risk. I have seen women who have lost weight and lost in their breasts reduce their risk. So it can be a factor with breasts for sure.
Hey, you guys, for those of you coming a little bit later, Brittany, I think let's take this question. We've already addressed the density of breast. And if you guys have more questions about testing and thermography, I will encourage you to reach out to Gaye and ask her that question so we can move on with the rest of the presentation. I just want to share, for those of you who are joining us a little bit later, I'm sipping on a nice herbal tea that has got red clover as well as red raspberry leaf, which are beautiful herbs that really help to help breast health. And it's really fascinating about herbs. Herbs have this affinity towards certain parts of the body, and these particular herbs really work wonders on the breast. So, Gaye, something that everybody's been waiting for, and that is let's talk about, why is it such a big deal about the lymphatic system and the breast? And how do we activate it?
A lot of times in a thermogram, when we see heat on a thermogram, it's simply due to lymphatic congestion. Obviously, bra wearing has a lot to do with this. It really confines the breast tissue and they don't move as well. And movement, of course, promotes lymphatic flow. So obviously, moving, just any kind of movement helps with overall health, but it helps with the breast. And Dr. Wren is the doctor who trained me, and he told me the first thing when he was training me, he said, Gaye, the hands-off approach to women's breast health is not working for them. Literally, women need to be in better touch with their breasts, not only get the best breast exam you can possibly get, but learn what's in your tissue. And through a thermogram mapping where we may find some inflammation, you can focus on that area. And I'll go into the breast exam right now, and with the wonderful oil that Magdalena has created, this would be a great, and this is a very nourishing thing. This is self-care. Yeah. This is very nourishing. I like to use the spokes of a wheel. Think of the breast, and there are spokes all around the breast tissue there. And the pressure is the most important thing to learn when you're doing a proper lymphatic massage of the breast. It's gently deep, Think of the breast as a sponge containing thick honey. Slow, deep sweets cause the honey to flow out. And use kind of the surface of your hand like this. But it's gently deep. And think of it, how much it is nourishing you as you do this. A couple of times on each spoke of the wheel. And close your eyes and visualize what it is doing. And it is doing a lot. So go around, like I said, the surface of the hand like this. Each spoke of the wheel. When you get up here, use the hand like that again and like this a couple of times each spoke of the wheel. And then when you get to the lateral breast, you're going to use the same hand motion here and sweep this area up underneath the armpit, the axilla, and it goes out of the body when we move this way. There is a wonderful diagram of this in Magdalena's book, and I hope everyone is going to get this book and read it because it's such valuable.
Well, I've learned this technique from you, so you are the master here. So this
Exactly.
The chart is here in case you want to have a refresher. And the recipe that I was showing this morning is on page 349, and it's called the breast massage oil. And basically, contains. I was showing it this morning: dandelion flower, calendula flower, comfrey root. And there is castor oil as well as jojoba oil as the oils that you infuse these herbs with. So really nice, easy formula. If you can infuse it within 6 to 8 hours in your slow cooker. So watch that video.
You definitely need to be able to glide, and that oil is going to help you easily do this massage.
So where do you typically do it? It's like, do you do it in the bathroom, like when you shower, or you do it after you come out of a shower and you use one of your oils, or like what do you recommend?
Some women do this in the shower, Magdalena, but some get out of the shower and then have a set time in the evening to do it before they go to bed because it's a very nurturing thing to do. You can get your spouse to help you with this, your partner.
Nice.
That's fine. We do encourage that as well. But, you have to come up with your own routine as when it fits into your schedule. But anytime you want to nourish yourself, this is a great way for self-care. And it's an area of the body that's overlooked as far as, we touch other parts of the body all the time, especially if something's hurting. Women with fibrocystic breasts, and I get a lot of women with fibrocystic breasts come to see me. They tell me this: Kay, I don't want to touch my breast. I don't know what I'm feeling. I'm feeling this lumpy bumpiness. What can I do about it? Of course, Magdalena's book addresses all the things that you can do. This is related to hormonal imbalance. And balancing your hormones is going to go a long way to making sure these cysts go away. But doing this lymphatic work regularly, making it a habit, it definitely makes them go away. And breast cupping is another thing. I may not have mentioned this in the first interview that Magdalena and I did, but there are cups. You can buy a machine that actually has silicone cups. And this is even a stronger way to massage the breast than even what your hand can do. So breast cupping is out there. You'll have to look for places that offer it. The person to whom I refer all of my clients has a cupping machine. They're not very expensive. They're not very difficult to learn to use, but I would advise you to try it. And if it resonates with you, and you can tell in the first couple of sessions with this, how it makes your breast feel. Some women with fibrocystic breasts, after using cupping for a certain amount of time, they describe their breasts feeling more like pillows. Ladies, when your breasts start to feel like pillows, I can assure you you've got healthy breast tissue.
Good. Okay. So we've got, actually, on this note, we've got this question from Juvan, who's saying, will using a vibration plate daily help with moving the lymphatic system in the breast?
Absolutely. A vibration plate, I don't have it in my space right now, but I have a rebounder here behind me. And I definitely promote a vibration plate. Not only does it help with overall movement and breast lymphatic movement, it really helps increase and maintain good bone density.
That's awesome. So tell us a little bit more about, besides massaging, what else can we do for our lymphatic system to really get it moving?
Well, I hope everyone listening to this afternoon exercises, okay? I assume a lot of you do, but any kind of exercise where there's some bouncing movement involved, as long as you're not confined to a tight exercise bra. And I do understand with larger breasted women, of course you have to have support when you run or walk. But I advise women to go up a size their exercise bra just to get some movement. I'm bouncing up and down because my office chair is a bouncy ball. Even if you don't have time to get on the vibration plate or do the rebounder, this I love my office chair because I can bounce up and down. And I'm not one of these people that stay still for very long anyway. But while I'm here working, I can go up and down. You see what this does to the breast tissue?
Yeah. Are we having a bit of like video problems? Brittany, are you seeing that too? I think we might be having, message me. Oh yeah, so yeah, we're seeing some video disruption on the Gaye side
too, and I don't know what to do.
Yeah,
it's kind of flashing.
That's a bit of a bummer. Let me just remove you for a second and see whether that stabilizes things, and then add you back to the stream. Yeah, no, we're still having that issue.
Going on.
The good news is that we're coming to an end. So let me just say also that Gaye is giving away 2 massage oils. And so, Gaye, I tell you what, why don't you drop off and get back on again with us and see whether that helps. That sometimes helps a lot.
Leave the studio.
Yeah, just yeah, okay. So while we're waiting for Gaye to come back on, sometimes it's like the best remedy is when you shut down your computer and restart it, and then everything works again. So I just want to give you guys also a quick recap. All the videos, if you're missing on any of the videos you missed out on from before then, like from yesterday or 2 days earlier, all the videos are going to be posted on overcomingestrogendominance.com/events. So everything is right there. And for those of you who are going to be getting the book, we've got something special for you on overcomingestrogendominance.com is what you get the book. And if you look at the section of like, what is the special thing for you when you enter your receipts, then we got some really nice gifts for you that we just want to gift it when you get the book. Let me see if I can add, Gaye, what I'm getting is your microphone and camera again needs to be added. Oh, there we go. Let's see if that's, you know what, maybe turn off.
Can you hear me?
I can hear you, yeah. Let's just keep your camera turned off.
That must be the issue because it was flashing. One thing I wanted to point out about the 2 things that I'm giving away, because this is another answer to the question about what else can I do?
Mm-hmm.
Well, the products, and these are the only, I promote iodine when a woman doesn't have autoimmune. If she's got a normal thyroid or an underactive thyroid, obviously even applying the iodine to the breast topically is going to affect the thyroid, as you know. So underactive thyroid or normal thyroid, this iodine spray directly on the breast tissue, improves lymphatic flow tremendously. Iodine kills bad cells in the tissue. And when you combine the iodine with the poke root is very, very strong, and it will reduce the size of these cysts that so many women have, these fibrocystic cysts. I've seen it repeatedly. The combination of iodine and poke root is a powerful combination. So women with fibrocystic breast can benefit tremendously. And the spray is just good overall for every woman to improve lymphatic flow and keep her breast tissue healthy.
Awesome. So you do sell those oils on your website, do you?
I don't on my website. Reach out to me by email.
Okay. You need to set up a store, Gaye.
I know. For those 2 things, those are the only 2 things I sell because they work. And
Linda is asking iodine and what? So the second, so iodine, everybody I think knows iodine, right? And so I just want to reemphasize this one more time. If you have Hashimoto's disease or Graves' disease or overactive thyroid, please do not put iodine on your breast tissue because it will get into your lymphatic system and it will make an impact and is not recommended. It's going to make your thyroid help, kind of little help. Okay. The second thing that that Gaye was talking about is poke, P-O-K-E,
Right.
and poke root. And so it's a very powerful root. The reason why, just, full disclosure, the reason why I did not include it in my book is because poke can be quite a controversial herb. And I was just afraid that people are gonna be like, oh, poke is gonna destroy my liver and all that kind of stuff, and then post it on Amazon. And so I just wanted to be careful. That's why I didn't add it in. But if you basically are not really, if you don't want to be bothered with making your own salves and oils and stuff like that, email Gaye and get her product. So the question from Jill, which is a good question, is poke root helpful without the iodine?
Absolutely, especially resolving those cysts.
Yeah. Poke is an incredible mover, and especially when you combine it. Do you use castor oil in your formula?
No, the only thing with the poke root is the Lugol's, which is the iodine, and the poke root extract that I get from a master herbalist.
I see. Gotcha.
And that combination will resolve cysts. There's no question about it. And the iodine, like I said, is good for every woman who doesn't have an autoimmune or hyperactive thyroid.
Okay, cool. So Sue is asking, I have Graves' disease, but it's in remission with diet. My labs look good without medications now for 3 years. Could I use iodine?
I would say yes. You no longer have Graves.
Yeah. And I will say to be also cautious with that, because autoimmune diseases do come back. My Hashimoto's is in remission, and when I go and do silly things, it does come back. So, so you gotta be real careful, especially with Graves. And you would know that it's not agreeing with you. I mean, your symptoms are gonna return. You're gonna, what the symptoms are when you have hyperthyroidism, which I actually found really, really difficult, far more difficult than Hashimoto's even. So we're gonna do the giveaway, you guys, and so the giveaway. So we got 2 products, right? One is the one with the iodine, the other one is with poke root, correct?
Correct.
Yeah. So the question for you guys, the first question is going to be about thermography. Is thermography, what's more important, sensitivity or resolution of the camera? Okay, sensitivity or resolution of the camera when you're getting thermography. So answer that question. So that's the first one. And Brittany, let's just make sure that when we are sending the product out, this person does not have Hashimoto's or Graves' disease or any thyroid problems.
Correct.
And so Mary got it right. She said, so who said sensitivity first? Somebody said, oh my God, now you guys are like, everybody's typing. I think Dusty. Dusty was the first one who said that. So sensitivity is the one. Yeah, good one. All right, next one is, how do you spell poke root?
I love it.
I'm just trying to make my life easier,
I love it.
How do you spell poke root? Okay, let's see who gets that right. Well, we're not getting any answers. Oh, there we go. Oh my goodness, it's Dusty again. Okay, Dusty, give somebody else a chance. So let's take the next person. Let's take the next person who got poke right. Okay, awesome. Simona has got it right. Okay, great. Well, you guys are gonna get the product on your way. Brittany's gonna be in touch to get your address and all that good stuff. So,
right.
Yeah, thank you for participating. Now we've got everybody typing poke root.
And by the way, I'll make sure when you email me about these products that I give you explicit directions about how to apply and use them.
Yes. Okay, great. So you guys, so let's put them in touch with Gaye. Let's pop out her website again. It's Healthy Breast, correct?
It's Holistic Breast Health.
Holistic Health Breast Health. Holistic Breast Health. There we go. Yeah. So good to have you here, Gaye. Always good talking to you.
I just made it out of sight, but at least during the majority of the interview, people could actually see me. But any questions that any of the audience have, please email me, go to my website, message me that way. I am here to help, and I welcome the opportunity to work with anyone out there who has a thermogram in any location, but just needs some guidance after the thermogram.
Awesome. And I'm, talking to you has also given me the discipline to get mine done. I've never done a thermogram, believe it or not. And I know I should. And so that's something I'm going to be doing. Actually, quick question for you. Apart from breast health, is there any value in doing a thermogram for like ovaries or the uterus, for example?
I get that quite a bit. A lot of people do full body scans. This is a surface test. It cannot go inside the body, so it's very difficult to see internal organs and be able to assess anything from imaging someone's abdomen, for example, because of visceral fat. So yes, there's some people who still want to do it. I just do not focus on other parts of the body other than the breast.
Gotcha.
One little thing, I also image the mouth.
Okay, sounds good.
What happens in the mouth can also affect the breast.
Okay. So yeah, let's take one more last question, and it's gonna be a wrap. Jill is asking, can you remind us of the other products she sells besides iodine and poke?
Well, I do the iodine spray, and then a roll-on that has the iodine and the poke root. Those are the only two things. I do promote, like Magdalena, the herbs that she mentions in her book, all those, and of course the natural aromatase inhibitors that prevents testosterone from converting to estrogen. So I give ideas to women about those things, and I don't sell them here because they can easily get them at Whole Foods, but you cannot get the poke root roll-on and the iodine spray anywhere without your making it. So I make it because it works.
Yeah, it really does. Okay. Well, I hope you guys have found this helpful today. And I know some people are saying you've missed out on this information. You haven't actually. Everything is going to be posted on overcomingestrogendominance.com/events. And you're going to catch the video there and the replay of that. Overcomingestrogendominance.com is the website. You can get the book and get the gifts that we have for you with the book right now. Thank you so much, Gaye, for being here today. I really appreciate your time and your lovely energy and your kindness. Always a good laugh. I'm a bit bummed that we missed out on breast fluffing that you were showing us.
Maybe you want to show them yourself.
Okay, I think you're totally putting me on the spot. I'm not particularly wearing the right thing for this, but and let me take my microphone off so that it doesn't get in the way.
Okay, a good ending, Magdalena.
That's very good ending. Okay, there we go. So breast fluffing, you guys, is about fluffing up your boobies. And the way you do this is you bend down and you grab your boobs right there in your hands. And you do like a good old massage like this. Really, that's all there is to it. And I'm very flat chested, so not much goodies there, but you can do it this way. And it feels actually very nicely and energizing, I have to say.
When you don't have time to do the lymphatic massage, this is a quick way to wake up every morning and say, welcome the new day. And I'm going to start my day with this fluffing to have no fear about breast. That's the thing about the culture we live in. There is a fear.
Fear, shame, sexuality around it. Yeah, for sure.
And the way to conquer fear is knowledge and empowerment. And this is what we're trying to do, both Magdalena and myself, in helping women along this journey.
Awesome. Thanks, you guys, for being here. I'm going to be later on, I'm going to be reading a chapter from my book on breast health, and I'm going to be talking about the other solutions other than thermograms and mammograms. And so stay tuned for that, and I will see you later. Bye for now.
Thanks, Magdalena.